Good, good afternoon, ladies and gentlemen. My name is Ru Junsha from Ruijin Hospital, Shanghai Jiao Tong University School of Medicine. I'm here to give you this report on behalf of my professor, Dr. Weiwei Zhan. I'm going to talk about standardized application of CUS in thyroid diseases. Here are 3 parts, and the first part we go to the clinical value of CUS in thyroid diseases. Contrast-enhanced ultrasound is widely used in many medical fields. Previous studies have confirmed its clinical application in the characterization of lesions and interventions. It reflects tissue microcirculatory perfusion with high sensitivity. The first application of CUS in thyroid is it can be used in differentiation of benign and malignant thyroid nodules. Here are 2 cases. The first one is hypoechoic nodule with peripheral hypoechoic halos. The CUS shows hyperenhancement with peripheral regular ring enhancement, and it is confirmed in cytology as nodular goiter. And the second one is an irregular hypoechoic nodule in grayscale ultrasound, and the CUS shows inhomogeneous hypoenhancement. And this one is finally confirmed in pathology as papillary thyroid carcinoma. Another application of CUS in thyroid is that it can be used in evaluation of thyroid cancer invasiveness, including the capsule and lymph node evaluation. It can be used to detect the capsule invasion that could not be detected by grayscale ultrasound. From the previous studies, it showed that ISO enhancement and hyperenhancement were correlated with capsule invasion. PTMC without lymph node metastasis usually presents synchronous enhancement, and while PTMC with lymph node metastasis usually presents slow progression. The peak intensity in the nodule and the peripheral ring of the nodule were analyzed to establish a prediction model to predict the probability of cervical lymph node metastasis in PBC patients. On the other hand, CUS can be used in guiding the thyroid fine needle aspiration. It is recommended in a guideline that CUS can be helpful in avoiding necrotic tissue or identifying perfused tissue in the biopsy of tumors. It is helpful in identifying biopsy targets inconspicuous on ultrasound. And this is a mixed mass. The same as the breast cancer and lymph node. When we use the CUS to evaluate the mass, we can see that there's a necrotic tissue in the middle of the mass. And to guide on the CUS, we can get abundant biopsy samples in order to get a good diagnosis quality. Another application is that CUS can be used in thyroid nodule ablation and evaluation. Before the ablation, we would firstly use the grayscale ultrasound to evaluate the nodule size, the location, the margin, and the border of the nodules. And then CUS would be added to accurately evaluate the nodule size and the border. And the post ablation, CUS would be used to assess the ablation efficiency. While under the CUS, if there's residual in the target nodule, a second ablation will be added, and until there's no perfusion. So this is a complete ablation. The second part, I will introduce the standard process of CUS in thyroid disease. And their content include 7 parts. The consent form from the patients, conventional ultrasound evaluation, the probe selection, instrument parameter adjustment, and contrast agent preparation, a real-time observation, and the post retrospective analysis of CUS examination. And there are also some tips for the CUS process. Let's watch a video.
然后让患者平静地呼吸，尽量减少吞咽。那我们这个很快就能解决这些重点的小查。那小查的时候，我们要容许一个2维的图像，然后分切。还有一个彩色。超声弹性调整，选取一个最佳的切面，然后对接下来我们的后线超声造影的一个路线进行了一个预演规划。在开始超声造影前，首先切换到造影状态，切换至造影模式，双幅。调节本体增益至甲状腺包膜刚好对侧位，适当调节深度。根据病灶的位置调节预焦焦点，焦点位于刚好位于病灶的中央。然后开始造影。开始开眼了，开计时开始，开始头部动作。
Alright, we can see from the video that the conventional ultrasound evaluation, the first step, the content includes ultrasound assessment of the lesions, such as 2D ultrasound evaluation, color Doppler evaluation, and elastography evaluation. And pre-scan area of the interest is very important in order to find the best imaging plan for CUS. And at this time, we can find an appropriate position of the probe around the nodule. At the selection of the probe, and I think every doctor is adapted to different probes, and we usually use the probe L311, LA332, and LA522, and the mode should be put on contrast mode. And when goes to the parameter adjustment, the mechanical index should be less than 0.1, and they should be kept in low frequency. And the storage duration should be preset to unlimited, and we generally actually use for 2 minutes. The dual image setting is usually used, but for the large lesion, a single mode is more appropriate. And the gain control should be set as when the image shows background noise a little before injection of contrast agent. And then adjust the focus position according to the depth of the lesion. When prepare the ultrasound contrast agent, we add 5 millimeter saline into the contrast agent and shaking it up sufficiently, and then inject the contrast agent in bolus. Start the timing, and a dynamic storage would be acquired. So we can see that this is a real-time dynamic observation of the CUS process. And a retrospective analysis of CUS process is very important. Include the morphology evaluation and quantitative analysis, such as perfusion area of the lesion. We can see the size change, the dynamic enhancement mode, intensity of enhancement, and the heterogeneous enhancement. And in the quantitative analysis, there are the time stress curve, microvascular quantitative evaluation, which includes the time to peak, peak intensity, gamma curve sharpness, AUC, etc. So we can see that this is a process from morphology to hemodynamics, also from qualitative analysis to quantitative analysis. And there are some tips during the process. Before we do CUS process, we would check the respiratory condition of the patient and ask the patient to avoid swallowing during this process. The contrast agent should be shaked sufficiently, and the gauge needle should be no smaller than 22 gauge. We use 1.5 to 2 millimeter solar view for CUS in thyroid. If a second rejection is needed, the time interval between the first injection and the second injection should be no less than 15 minutes. After CUS process, patients should stay for 30 minutes to observe if there to avoid some discomforts. For example, the allergy, and then the fast treatment would be conducted. So then we go through the report. The contrast agent species, the dose, the infusion routine, and method should be included. The time of enhancement and clearance, enhancement mode, intensity of enhancement should be also included. Here's a report writing of CUS in Ruijin Hospital. We can see that on the top of the report, there are informations of the patient, and we will give the patient several images of the CUS of thyroid. And then is the description of ultrasound, and on the bottom of the report, here's the final diagnosis from the doctors and some recommendations for the clinical doctors. All right, then we'll go to the Q&A part. Question 1. What's the most valuable application of CUS in thyroid diseases? A. Differentiation of benign and malignant thyroid nodule. B. Evaluation of thyroid invasiveness, capsule and lymph node. C. CUS-guided thyroid fine needle aspiration. And D. CUS in thyroid ablation and evaluation. Choose only one answer. Please scan the QC code. Okay. The answer should be B. And question 2. Which of the following US finding is the most likely diagnosis? Here's a nodule in the right lobe of the thyroid. And this is a CUS characteristics of this nodule. And we have 4 selections. A. Subacute thyroiditis. B. Papillary thyroid carcinoma. C. Concentrated cystic thyroid nodule. And D. Thyroid adenoma. Please show. Okay. All right. Everybody's smart. Actually, the answer is C. Concentrated cystic thyroid nodule. Okay, thank you.